You are the FI1 on a general surgical team. A medical student has been attached to the team and has asked you to help them improve their cannulation skills. They have practiced on a plastic model but have not carried out the skill on a patient yet and do not feel confident. You have a long list of jobs to do today, including 3 cannulas, several discharge summaries and clerking in a new patient. Choose the 3 most appropriate actions to take in this situation. A. Ask the FI2 to supervise the student when they have time. B. Ask the patient to consent to cannulation by the student but do not specify their level of experience. C. Ask the student to carry out the cannulation so that you can complete your other jobs, but tell them to come and find you if they have any problems. D. Ask the student to clerk in the waiting patient while you complete the discharge summaries, then you can do the cannulas together. E. Get the student to observe you inserting the cannulas today and say that they can carry out the procedure themselves another day. F. Inform the patient that cannulation is a new skill for the student and ask for their consent. G. Send the student to clinical skills to practice more on plastic models. H. Supervise the student throughout the procedure. Answer. DFH. You should support the student to carry out cannulation. Although you are busy, your jobs are routine, and you have a responsibility to work with students. In addition, the student has already had teaching by simulation. Options E and G are therefore not the most appropriate, as they avoid facilitating practical participation of the student. Option A is also avoidant, and it is likely that the FI2 is busy too. Handing responsibility for the student over to them may be seen as unfair team working. It is important to inform patients of the level of skill of the person performing a procedure if you think that this information may affect their decision to consent. Option B is therefore not one of the most appropriate, whereas option F is one of the best answers. The student has not carried out the procedure before, so it is important for them to be supervised, H, which both ensures patient safety and supports the student to build their confidence. This makes option C inappropriate since it is an inadequate level of supervision for the first attempt at a skill. Delegating appropriately to team members is important in managing your workload. Asking the student to carry out the clerking for you prior to doing the cannulas together, D, is a deal which benefits both of you, especially as clerking is also educationally valuable for the student. Option D is therefore one of the best options. You are the FI1 on the medical admissions unit and are clerking in a patient with community-acquired pneumonia. They have a past medical history of kidney transplantation and, as a result, take an immunosuppressant drug to prevent rejection of the transplant. You need to ensure their drug chart is completed with the necessary medicines prescribed for this admission. Rank in order the following actions in response to this situation. 1 equals most appropriate, 5 equals least appropriate. A. Do not prescribe anything but alert your registrar that there is a complex patient who requires their input. B. Call the patient's transplant team for advice. C. Prescribe antibiotics according to trust protocol for the pneumonia and the regular immunosuppressant, copying the details from the patient's repeat prescription paperwork. D. Prescribe antibiotics according to trust protocol for the pneumonia, but do not prescribe the immunosuppressant and alert your registrar that they need to complete this prescription. E. Prescribe antibiotics according to trust protocol for the pneumonia, but do not prescribe the immunosuppressant because the patient has an acute infection. Answer D, A, B, E, C. FI1 doctors are not allowed to prescribe or transcribe cytotoxic or immunosuppressant drugs. The worst response is therefore one that involves prescribing the immunosuppressant, C. The best course of action is to prescribe acute antibiotics, which is within your competence and can be done following local protocol, and leave the prescription of the immunosuppressant to your registrar, D. This is better than prescribing nothing, A, as there is no reason why you shouldn't prescribe antibiotics and delaying this could be harmful. It would be advisable to get input from seniors within your team before consulting another team, B, but this response is a safe one and may be useful further down the line. Whatever you decide, you should not make the decision to discontinue the immunosuppressant, E. This response ranks second last because it makes no mention of alerting seniors, so the patient could miss doses of their immunosuppressant based solely on your decision, which would be dangerous. However, this is still safer than breaking the rules and prescribing the immunosuppressant, C.